Hello, my name is Dr. Roman at Pacific Park Family Dental. Today, I'd like to discuss a subject that a lot of patients want an answer on, but there's not very many answers online. So, these are the most searched questions on Google that patients frequently ask. So, for your convenience, I'll just explain everything here so you don't have to go anywhere looking for this information. Okay, in my practice, I do IV sedation, and a lot of times people need this service in order to feel comfortable and happy at the dentist. So, why would somebody need to be sedated for dentistry, and how does this help patients? So, what I see is some people come to my practice, and as I'm talking to them, I can see them just melting through the chair. I know they're terrified. I know they're scared, and not only scared of dental procedures, they're afraid of me judging them as a person. So what I can tell you is that it's not my place to judge. I see a situation that we need to address, and we're addressing that situation. You are here with me because you need help, and I'm here to give help. And that's as simple as that. Sometimes there is a barrier that's called I'm nervous, or that's called I'm anxious, or I'm scared of dentistry. How do we tackle this? And thank God, there is so many tools in my toolbox that I can give you that will make dentistry easy, pleasant, and comfortable for you. This is as simple as it gets. So what kind of sedation do we have in our office? Okay, so I've been doing sedation for a few years, and I found that nitrous sedation doesn't really work in my hands as well. I see it work, but I never get the result that I want, and my patients don't quite fully feel as comfortable as I want them to feel. So I shifted away from doing nitrous sedation, but I do pill form of sedation. So a little bit of Halcyon, and what I do is one pill 1 hour before and another pill at the appointment. I know it's a little bit different than most dentists do, but I can do this because I have a lot of agents that can counteract an overdose. So I'm licensed in IV sedation. So even if we have a little bit over sedation with intraoral medication, I can always counteract it quickly. So I'm not afraid that somebody will fall asleep in my chair. I can quickly remedy this situation. So when a patient comes in and takes that second dose of oral sedation, it's easy for them because they don't remember anything, and it ends up being a comfortable experience. We can place implants, we can remove wisdom teeth, we can do root canals, and patients are happy. They fall asleep at the procedure and they remember nothing. It's wonderful. So for 90% of people, that really works. For the remaining maybe 5% of people, what we do is we layer a narcotic on top of that. So we do a little bit of Halcyon, and we layer maybe an oxycodone. And that gets people into their happy place. We're not trying to put people to sleep. We're just trying to get them to be a little bit more relaxed so we can do procedures. And a lot of the times where I want patients is readily responsive, but not asleep. So what that means is that if I tap somebody on the arm and say, "Hey, how you doing, Bob?" Bob will open up his eyes and say, "Hey, I'm doing great. Thank you for asking," and go right back to resting. I don't want a patient to be non-responsive during sedation. That is too deep for us. We want them to be nicely comfortable, but not in deep sleep. We're not trying to go to deep sleep. So the last form of sedation that I do is called IV sedation. This is when I need to actually control the medications in such a tight fashion that I can drip dose it into your vein that I know exactly what's happening. And this is maybe 2 or 3% of my entire population that I have to sedate. When a patient is really nervous and I have to get them to this perfect place where they don't remember anything, where they are not exactly aware of any discomfort, but I can tap them on the shoulder, ask them to take a breath, and they will do that for me. So 3 types of sedations we do in our clinic is oral sedation with only Halcyon, or oral sedation with Halcyon and a light narcotic added, which will give us a more exaggerated effect of sedation, or we do IV sedation. So who's a good candidate? If you were to come to me, how do you know that you are okay to be sedated? For sedation via a pill, almost anybody works. There's very few contraindications that we need to we need to check before sedating you that way. But 99% of people will do okay being sedated this way. For IV sedation, we definitely want to exercise a little bit more control. If I see some things in history, like such as strokes or heart attacks that are been in the last year, I want to know if your doctor approves of me doing some IV sedation. In some cases, IV sedation would even be preferable to do on these patients because of how much less stress that would exude on your body. We know that stress, especially emotional stress, can trigger a whole slew of things, and minimizing that really benefits and helps your health in the long run, especially if you have suffered things like a stroke or a heart attack, because a stressful situation can exacerbate these already problematic situations. One thing that I want to highlight, there is a difference between sedation and general anesthesia. So sedation is not going to sleep. When we say I want to be completely out and not remember anything, not being able to breathe, and somebody is controlling my body for me, that is general anesthesia. We do not do that. And we don't have to do that. For us to get the same response out of the patient to say, I don't remember anything, I feel like I was completely out, moderate sedation is good enough. Because when people wake up from moderate sedation, they don't remember anything. The medications that we use, they will block the memory from forming any new memories. So basically, as soon as the medication goes into the vein, that will block the memory portion of the brain from creating new memories. And that means that anything that happens will be instantly erased from your mind. It's as if it's never happened for you. The difference is we don't have to breathe for you. We don't have to respond for you. So in moderate sedation, you're breathing, you're swallowing, you're coughing. If something gets in your throat, you'll cough it out. You have full control over your body. You just don't know it. In general anesthesia, you don't have full control over your body. Somebody has to do that for you. And this is why intubation is so important in general anesthesia, is because we want to protect the airway. We want to be able to control your body to such a degree that we can guarantee success in all aspects of this sedation or anesthesia. In moderate sedation, that is not so important because you as a person are doing everything. We are just helping you get through the procedure. And that's the key fundamental difference between those two. What is nitrous oxide and why do dentists still use it? So nitrous oxide is a wonderful thing. It has been discovered by this guy that was playing with gases, and he realized that he can get, quote unquote, drunk off of this particular gas with no hangover, and it comes quickly and it evaporates quickly. And this is how nitrous oxide was discovered. It started being employed in dentistry a long time ago, and as a sedative agent, we've been doing this for decades. Now, a lot of dentists still use nitrous oxide because it is so great. It has quick onset and it has quick release, and people can drive after that. In my hands, I've done nitrous oxide and I wasn't really pleased with the results that I got out of it. It is much easier and cheaper for the patient just to have an intraoral type of drug sedation, and that way they don't have to pay for it. The only cost that the patient incurs with this type of sedation is the cost of the pill, which is maybe $5 at the drugstore. How does oral sedation work in dentistry? So the way oral sedation works is that when you take that medication, it reaches your blood system over the course of about 30 minutes to an hour. So when I have my patients come into the office 1 hour before and they take that first dose of Valium, let's say, I can see after 30 minutes they're starting to get a little off balance. They're still responsive, but it looks like as if they had a few glasses of wine to drink. And then the second dose, when they have it an hour later, they really get comfortable. They're still plenty responsive. I can talk to them and they're coherent. It's just nothing bothers them anymore. They're not scared. They're not nervous. They're more in a lighthearted mood. They joke around a little bit easier. And that's why the whole dental appointment goes a little bit smoother, because things are not as serious all of a sudden, and they're not as terrified. There's no anxiety. For people that this approach doesn't really work yet, or they need a little bit more, we do recommend IV sedation completely, a moderate IV sedation, just so we can add a few more drugs to this cocktail so they feel even more comfortable. So this brings us to a question. What is IV sedation in dentistry and when is it recommended? So really, IV sedation, as we mentioned before, this is when we install an IV into your arm and we're able to control the exact dosage. How do we know how much you need? There's approximately a standard dose that gets calculated for your height and weight, these parameters that we give you at the start. So we don't put you all the way down. We give you a little tiny dose that we know is going to get you relaxed but not fully sedated, and then we wait maybe 5 minutes. And then as these drugs start to work in your system, you will start slurring speech, you will start kind of getting more relaxed, your eyes will start to drift, and a lot of my patients say, hey, the ceiling is moving or the room is spinning. And when I hear these phrases, I know that we're so close. And then once we're at that threshold, I know I just need to give them a tiny little bump. Just a tiny bit, a drop of medication, and then pretty soon their eyes roll back, they're relaxed, they're breathing on their own, and all I have to do to get them out of that nice daze is tap them on the shoulder and say, hey buddy, how you doing? Is everything fine? And typically they look at me, they smile, and they go right back to relaxing. And that's perfect. That's when I know that sedation has been done well. I can start my work. And typically, even if you pinch the patient, you give them a shot, it's not noticeable. They don't really respond. They don't remember the discomfort. They're in their happy moment. You don't mess with it. You just do your dentistry and it gets done well. What kind of drugs do we use for IV sedation? Principally, we use 2 drugs. And for moderate IV sedation, this is like the bread and butter. We use a little bit of fentanyl and we use a little bit of midazolam. And again, I know fentanyl gets a bad rap. Why does it get a bad rap? Well, of course, fentanyl is on the street killing people. What's happening? Yes, fentanyl is so potent. It's such a potent drug that we don't measure it in milligrams. So let's say we measure everything in milligrams. We measure antibiotics in milligrams. We measure drugs in milligrams. We measure midazolam. It's one of my sedation drugs. We measure in milligrams. Fentanyl, we measure in micrograms. It's 1,000 times smaller than a milligram. So why? Because the effect that it has on the mind, on the central nervous system, it can suppress your breathing so quickly if you're not careful with it. And this is something that people don't understand on the street. They just sell it like candy, and you can't. It's a powerful, powerful drug. So you absolutely need to dose it right. And we've been trained how to dose it. This is why we don't overdose on these things. We know exactly how much to give. So you give approximately 20, 30, 40, sometimes 50 micrograms and see how the person responds. And what you're waiting for is a gentle relaxation for the person to feel. They start to feel a little bit of euphoria. They start to feel relaxed and happy and cheerful, and the nerves and the stress kind of goes away, and you know that what you're doing is correct and it's working. So fentanyl is the feel-good drug, and midazolam is the forget your worries drug. Once the midazolam is administered, you will not remember anything that's happened. But those 2 separate drugs, when they are mixed, they create a synergistic effect. What that means is that if the effect of fentanyl is this much, and the effect of midazolam is this much, together, it's not added, it's more, without the suppression of your breathing. So that means you will still breathe totally fine through sedation, but because those 2 drugs are working on different receptors in your head and in your central nervous system, you get a more profound relaxation. You get a more profound sedative experience. So that's a wonderful way to do it. And this is why we do it this way, and we have fantastic success. Moderate sedation is one of the safest types of sedation to do. I don't think there's any deaths that have been recorded from moderate sedation. Unless, of course, the dentist mismanaged the medications. That's a different story. However, from doing proper moderate IV sedation, I don't think there's any recorded deaths due to that. Is IV sedation safe and okay for everybody? Is it okay for children? So let's say you have a 10-year-old you'd like to sedate. It is safe for children. However, In our practice, we stay away from children. Children are a totally breed of human beings. We don't touch them with IV medications. They need to go to a specialist for that because they're young and precious and we want to protect their health. And I feel like there needs to be somebody more qualified to do it. I want somebody with experience to do it because the child's body is not like a small adult. They have a different metabolic rate. They have a different tolerance to drugs. And I want somebody who can handle that better. I don't feel like I would want to take that on myself. That's why I give it to somebody who is more qualified to do that. Anybody who's 14 and older, their bodies are more adult and their metabolic rates are more predictable. I know exactly how my drugs will react in their systems. I can do that. Totally fine. How does pediatric sedation dentistry differ from adult sedation dentistry? So, when we're sedating an adult, we know that all the systems have been developed and they work in more of a predictable fashion. And this is what makes moderate IV sedation so predictable and easy and comfortable and great and successful, is because adults, they more or less function within the same rate of metabolism. They all sort of work in a similar fashion. When it comes to kids bodies are so much smaller and their reactions to medications can vary so much greater that it makes the sedation unpredictable. And what you want for a children's sedation is a specialist. You want an anesthesiologist to do that sedation, because if that tiny body decides to throw a wrench in the works, we need somebody who knows how to rescue that particular project. We want to know that somebody is able to handle the situation. When a person is an adult, that almost never happens because the way an adult body works with that medication is much more predictable. Having said all this, are there any risks or side effects associated with the sedation dentistry? Yes, there are always risks. There are always risks that a sedation medication will cause an opposite reaction. It has been documented that sometimes midazolam causes more irritation. So I have had doctors tell me that, hey, we injected a person with this particular medication and they got really, really irritated and left. Was the sedation done inappropriately? No. Sometimes the medications that we use, they cause a different effect, not a sedative effect. They cause a completely opposite reaction. It has been documented. That's one of the risks. Another one of the risks is that if we have a small person and we dose them a little bit more, we can have oversedation. It means that we're going from moderate to deeper form of sedation. And the typical cure for that is to stop, observe the person, make sure they're breathing, wait 30 minutes, and everything will normalize. However, these risks, when they're accounted for, they can be mitigated and well handled and balanced, and things go great. So what can you expect during a dental procedure with sedation dentistry? Typically, my sedation appointments run like this. A patient comes in a little bit nervous. So we banter a little bit, talk. I ask them what I can do to make them less nervous, if I can get them some water. It's okay to have a little bit of water before sedation. It's not okay to eat, but it's okay to have clear liquids. So we talk a little bit, and then I install an IV. Process takes usually 5 to 10 minutes. And once they're happy, they asked all their questions, they felt like I've answered everything, we inject some drugs into the vein and we start our process. We start slowly. I give a little bit of a medication and see how it works. See that everything is going according to plan. And once I see that smile, once I see that the nerves are gone and the anxiety has ceased, I can start getting them to a place that they are not going to remember whatever I do. And once I know that they're there, and the typical sign is complete relaxation, even breathing, and then eyes rolling back into the back of their head, just kind of like nice and relaxed, I know that we're okay to start. And I also know that the patient is breathing on their own and they're going to be totally fine. If they need to address something to me, I just tap them on the shoulder. They will tell me something if it's necessary, or they'll cough something up. Totally okay, because they're in full control of their body. They're just not going to remember it. Once they're sedated, we do our dentistry, and then Typically, once we're done, I can see them starting to move around a little bit more. We remove the IV, we set them up, and we say, okay, we're done. And the typical response I get is that, oh, wow, when did we start? And that's how you know that they don't remember anything. And typically, that memory wipe medication actually works a lot longer than you expect. So patients actually come to my post-op appointments after sedation, and they say, oh, I only started understanding what's happening to me once I was home in my bed. And that's it. I even had one patient, his wife took him grocery shopping after we removed his wisdom teeth and did a sedation appointment all in the same time, and everything went so great. The wife was like, oh, he's fine to go grocery shopping, and they went grocery shopping, and it was very interesting to hear that he started understanding that, oh, I'm in the middle of a grocery store, and that's how like he came to, basically, in the middle of a grocery store. So imagine waking up, being surrounded by people and produce. That's one interesting way to wake up. So, how does laughing gas, how does nitrous oxide make you feel at the dentist? It usually makes you feel like you've had a glass of wine, but that's it. It's not going to help to dull any discomfort or pain. If you're feeling nervous, you're still going to feel a little bit nervous, but at least, it's kind of muted, let's say. And how long does it take to wear off for nitrous oxide? Within a minute. As soon as the gas stops, it wears off. How long does it take for IV sedation to wear off? It really is dependent on the dose that we give you. As long as the dose is within the normal kind of range that we have given you, it takes about an hour to wear off completely. But the patient is responsive, they can walk, they can be totally functional right after we sit them up. We don't give a lot of sedation for that specific reason. We don't want a patient to be completely out of it when we're done. We want the patient to forget what we've done, but be sort of there and functional so they can get out of the chair, get to their car and go home happily. Question is, can I request sedation for my dental procedure? Yes, absolutely. We just have to know a little bit in advance. We have to know if we need to do any medical clearances. We have to kind of instruct on how to do it. It's hard to do sedation the same day. We have done it in individualized cases where, let's say, somebody comes in, they haven't eaten today, and they want their wisdom teeth out, and it happens that the stars line up, they're perfectly healthy, and they're ready to go. Okay, that's totally fine. We can do it today. And usually it happens very rarely. But if you tell us in advance, we can prepare you and we can get you in for a sedation procedure and then whatever needs to be done alongside with that. Can sedation be used for all dental procedures? Yeah, pretty much. You just have to let us know that you want this service. For a lot of times, just to save people money, I tell them what I think. So for example, let's say a person comes to me and they tell me, hey, I really want a cleaning, but I'm so terrified, I think I need IV sedation. And I'll tell you outright, listen, I'm happy to sedate you. I just think it's a little bit of waste of your money. How about we try the oral sedation? I'll give you some medications. You come in, I'll do a mild cleaning. If it works for you, boom, you saved $1,000 at least. That way, you can spend it on your next vacation. How about that? So rather than kind of treating everything as, if you have a hammer, everything looks like a nail. I don't want to treat everything with a hammer. I don't want to sedate everybody. I want to use the right tool for the right cause. So if you need something light, and I know that it's okay to give you some oral sedation, that's the way we will go. And I will advise you to do that. I'll be honest with you. If it's something serious like wisdom teeth or multiple implants or some heavy surgery that we have to do, and you are afraid, and I know that if we give you oral medication, it's not going to do as much as we need for you to be comfortable throughout the entire procedure, then I'll tell you that. First of all, and most of all, I seek to be completely transparent with my patients. So I'll tell them, hey, this is how it works, and this is what I think, and this is what we should probably do. And we can try out with something small, and then see how you do further on. And if we need to make adjustments, we'll make adjustments. It's not a big deal. So how do you prepare for a sedation appointment? We tell people always get a good night of sleep. Always. I mean, sleep is such an important thing. When people haven't slept before an appointment, it feels like my numbing medication doesn't work as well. So, of course, not being stressed, being well rested is just so important for a good dental appointment. But let's say you're really nervous and now you're also nervous to the point that you can't sleep. Don't let it stress you out. Of course, we will work around whatever you bring to us in the morning and we'll just go with it. We'll roll with the punches. It's okay. That's what we do. We want you not to eat anything before IV sedation. Clear liquids is okay. It's okay for you to have dinner, but about 8 hours before the procedure, we don't want you to have any milk, any yogurt, only clear liquids. Apple juice, water is okay, but no food, please. Okay, so also we don't want you to smoke any pot. Some people do that. They think that they will get a much more pronounced sedative experience, but don't do that. It will just mess with my medications, and we don't want that. Also, don't drink. Please don't drink for a few days before you're getting your sedation. Alcohol really messes with my medications. So I can actually tell when a person is a heavy drinker or a heavy drug user because it just takes so much more dosing just to get them to their happy place. So yes, don't do that, please. So what should you do if you have concerns regarding the safety of sedation dentistry or how it's done, or you just want to talk about it? You can always call me. You can come into my practice, have a short consult appointment, and ask these questions because these are the questions that people ask me every single time for sedation, and we do so much of it. We discuss this with every single patient. So we don't want this to be some sort of black magic thing that we do that you know nothing about. No, we want this to be easy, transparent, nice. So when you're going into it, you know exactly what you're signing up for and you know exactly what you're about to get. So in the end, it's a positive experience for you. And that's kind of the bottom line. Dentistry has to be pleasant, easy, comfortable. And if it requires IV sedation, it just requires IV sedation. It's not a big deal.